It started when I woke up one morning, doing my normal routine, changing my dressing. One of the veins popped. I got scared, because this one was serious.
That's when I saw the wound, of course, and I realized the severity of the situation. She couldn't do it on her own.
Mrs. Johnson came into our clinic. She was limping, she was apprehensive, she was embarrassed. When we started removing the dressing that she had, she was fearful, she was in pain. I saw that this person has been through a lot.
Before, I would just stay in my room, don't go outside. That was my life for 3 years.
When Ms. Johnson first came to see me, there was a lot of challenges facing her ulcer. She presented with a very large ulcer, and it was draining copious amount of drainage that required multiple dressing changes daily.
Then she said, oh, maybe you need to see a vein specialist. I went there for a couple months. He told me about Dr. Frank. I've been going everywhere else. Let me go see Dr. Frank.
I chose Mepilex Up for this patient because of the success that we've had at the other clinics. This patient drives 2 hours just to see me. She can't make it here all the time, so I had to pick a dressing that would increase the absorbency of what she was using. I knew I had to go from 4 to 5 dressing changes a day to once every so many days. And also I had to pick something that was not painful because she already was so apprehensive and she was on so many pain medications.
So with this product, after the first week, she didn't need any pain medicine, and the dressing change is a lot simpler because she's not in any pain, and it's easy to remove, and it's easy to put back on too.
So we've realized what is something that will work to contain her fluid. Mepilex Up has done that for us.
So clinically, the difference that we started seeing, the granulation was different than what we've seen before. We started seeing closure. This patient has had a wound for 3 years, but more importantly, we had a thin dressing that actually was absorbing really well. So we turned into from 4 to 5 dressing changes a day to 1 dressing change every 4 days. So that started changing her life.
For 2 years, it was only getting bigger, the wound, but now skin is finally growing back. It's finally getting smaller.
Well, life is better now. I can actually walk. I feel better about myself. I actually went back to work a couple days and doing a lot more than I used to do.
This patient has changed how I treat patients because when she came in, she was debilitated. She was walking with a cane. And now she's like a flower. She's blossoming, she's planning her vacation, and she is back at being a mom to her 2 kids.
Over the short amount of time we've been treating Ms. Johnson, she's been doing really well, been able to return to work, and she's smiling when I see her now.
Now that I'm using Mepilex Up, I'm no longer using the cane. I can walk in a crowd. Mepilex Up gave me my life back.
Mepilex Up gave me my mom back.
I'm no longer suffering in silence. Now I'm back to being me.